Now, on New Year's Day, Nigeria recorded 1,074 new cases of COVID-19, making it one of the highest figures recorded so far since the virus began spreading in the country. Now, the Nigeria Center for Disease Control says the toll of the infection in the country now stands at 89,163. The health agency also added that 74,789 cases have been discharged and 1,302 deaths have been recorded in 36 states and the Federal Capital Territory. Meanwhile, the federal government has warned that a significant increase in coronavirus infections in Nigeria appears imminent this January due to continued violation of safety protocols during the Yuletide period.
And to analyse how the country has coped so far and what it needs to do in the future, we're now joined by Dr. Sani Aliyu, the National Coordinator of the Presidential Task Force on COVID-19. Glad to have you join us, Dr. Sani. All right. Good afternoon. Now, the obvious question I think everybody's been asking now is government planning to make vaccines available to Nigerians? When should we expect the first batches and will they be free?
Well, I'll start off with the last question. Of course, they will be free. Nobody will be charged for the vaccine. This is a public health intervention. And as with all public health interventions, you don't expect the public to pay for it. In terms of when it's going to be available, there's a lot of work going on with the National Primary Healthcare Development Agency. Mr. President also directed the PTF about 2 weeks ago to get involved with the nitty-gritty of making sure that the vaccines do come in a timely manner. We are expecting the first batch of vaccines possibly towards the end of January. But there's a lot of work going on with our partners, in particular Gavi. Nigeria should not be left behind. The control of the COVID pandemic will rely not only on full compliance with non-pharmaceutical interventions, but also the availability and acceptance of vaccination programs. We cannot allow ourselves to become a pariah nation. We don't really have a choice when it comes to vaccines. We have to vaccinate our public, especially those that are vulnerable, the elderly, those that are most likely to have severe illness. And we will definitely not be left behind as a country.
Now, Dr. Sani, let me go back to some of the things that you said with regards to Nigeria the acceptance, basically. Should Nigerians reject or refuse, the vaccination? How will, the Presidential Task Force, your team, how do you hope to sort of cope with that? Should they refuse? Because there are reports that are suggesting that not everyone is, sort of open to taking the vaccine.
So, of course, we've had experience with the polio vaccination program, if you remember, about 10, 15 years back. And it's the same agency that had to deal with this. With vaccine, it's across the world. It's not just in Nigeria. We have issues of vaccine hesitancy and vaccine acceptance. And with the advent of social media, this has not helped at all. There's a lot of negative news going on with regards to vaccination programs, not just for COVID, but across the board, including childhood vaccines. At the end of the day, we know that the only thing that can control this pandemic are two things, really: non-pharmaceutical interventions and vaccines. We are not going to force people to take the vaccine. We're not going to press you down and inject you. That's never happened. But we will continue to engage with the communities, particularly our religious leaders, our traditional rulers, people within the communities, to convince them that it's in their best interest, it's in our overall best interest to accept these vaccines and make sure that we all have them, because it will protect us. Some of the vaccines have very good efficacy, particularly the Pfizer vaccines, for instance, and Moderna, over 90% efficacy. Even the Oxford AstraZeneca has about 70% efficacy based on the initial trials. And possibly with some modification in the way they are administered, we can probably improve their efficiency. So overall, Nigeria cannot be left behind, as I said. And if we want to travel, in the future, in the next 6 months to a year, I am very sure if you're going to travel abroad, you will need to have some evidence that you've had the vaccine, because these people are not silly. They're not going to allow their populations to become infected again with COVID. If you're going to travel, if you're going to go for Umrah or Hajj or a religious pilgrimage to Israel, for instance, you're going to business in China, you're going on holiday to Dubai, you will require a vaccine. I am very certain of that, because all this testing in terms of travel, etc., will have to stop. It's already affecting the travel industry seriously, and it's affecting the way we do business and our economy. Secondly, for countries that continue to be endemic for COVID, they're not going to have people going in to invest. So it's overall in our collective best interest to get on top of the COVID pandemic. And then lastly, this is a disease that kills. There's no doubt. You can see it even from the figures over the last 1 to 2 weeks. They've been going up. The mortality always lags behind by about 2 to 3 weeks. And it's only now we're going to start seeing the impact of having over 1,000 infections a day. Our treatment centers are already starting to fill up fairly quickly. I had a very long discussion with Lagos yesterday, and they were having serious problems with their beds, and they have to start looking at opening up more beds as well. So let's work towards getting the vaccine, which we are doing from the government side, but we also know that there's a lot of work required to convince people to take the vaccine. I'm very certain that if we do this properly, people will realize that it's in their best interest to receive the vaccine.
Indeed, Dr. Sani, I'd like to take you back to what you noted about the traveling scenario here. We have reports indicating some Nigerians are acquiring fake medical reports on COVID coverage. How are you handling that scenario, especially when it has to do with international travelers?
We are already putting in place control measures. So when it comes to leaving the country, we've already directed the laboratories, and they all have this system in place. It's just that we need a single system rather than getting airlines to go into different websites, etc. But if you present a COVID report or certificate on your way out of the country, the airlines will be directed to check on a web. They will enter a particular code relevant to that result and check whether it's genuine or not. And if it's not genuine, we will get you arrested. Definitely, we will take action to make sure that this stops. When it comes to people coming in with fake results, we've already had meetings with members of the diplomatic community back in September, and we've shown them some of the results we had for specific countries where there was a significant discrepancy between the negative results that people were coming in with and the repeat result that we were having. At the time, we were testing at around 48, 72 hours after arrival. And they've given us assurance, and some of them have also given us a list of the laboratories that we should be working with. But overall, fake results and criminality exists across the world. It's not just in this country or in Africa. After all, people produce counterfeit currency, talk less of certification. My appeal to the general public is it's not in your best interest to present a fake result. And if we do get you presenting a fake COVID certificate, we definitely will not let it lying down. Because in a way, you are increasing the risk for our citizens, and you're potentially putting people that are vulnerable to severe infection, and the likelihood of dying is considerable. So we're not going to take this lying down. The gloves are off when it comes to travel. Just today, we have already finalized the first list of 100 passengers. The full list will come out tomorrow in the newspapers. These passengers have now had their travel documents, their passports, with the restrictions, travel restrictions. They will not be able to travel over the next 6 months. And every week, we will be taking another 100 and publish until we have an improvement in the compliance when it comes to our travel protocols. We don't want to put travel bans, but if people are not complying with our protocols and it's not working, we'll have no option but to do so. But for now, we're going to enforce this by making sure that those penalties that we've agreed with the presidency are applied across the board to those that continue to willfully ignore our protocols and bring in infections that are going to affect our economy and our people as well.
Now, Dr. Sani, I'd like to sort of get clarification on one of the things that you said with regards to names being published, the 100 passengers that have been handed out a 6 months ban. I just needed clarification with regards to the names being published, because there are some reports that suggest that names will be published, and you've also said that...
We will not publish names. We will not publish names.
Okay, that's what I wanted clarification on, because
we are publishing passport. Yeah. We wanted Let me just clarify. We will be publishing passport numbers, and all 100 have been reached out to initially to confirm whether or not they've had the test done, and we've subsequently contacted them either by phone or by text message to inform them that their passport numbers, their passports have restrictions in place, and they will not be able to travel with these passports. So there will be no surprises in terms of the individuals. But the key message we're trying to send out is from now on, we will continue to do this every week until we have an improvement in compliance. We delayed doing this thinking that we'll be able to convince people to do the right thing, but clearly this isn't working, and we have to apply the sanctions, we have to apply the penalty that we've always had, and we've had the go-ahead from the presidency to do so. So by tomorrow, already the list is already online. I think a few newspapers have published it today, but the final list, the validated list, the validated advert will go out tomorrow, and all 100 not names, but numbers will be published online.
Indeed, Dr. Sani. Now, attention seems to be focused more on prevention of this pandemic, especially through inoculations, as it were. But what about finding a cure for COVID-19? We haven't been hearing much about that lately.
So I'm afraid we're still a very long way. Remember, coronaviruses are RNA viruses. They're just like HIV. What you do is you try to control the epidemic. HIV has been with us since the early 80s. What we have is treatment that keeps the infection at bay. HIV is a chronic infection. Fortunately, coronaviruses are acute infections. You either get better or you deteriorate. The approach really is that of prevention. There's no specific treatment. Very few RNA viruses really have specific treatment. So even influenza, for instance, where we have oseltamivir and other antivirals, they don't work as well as the antimicrobials. So in general, because of the rate of mutation, the rate of changes within the virus itself, it's very difficult to have effective antivirals. It will probably take ages. The best approach really is prevention. Stop it from happening in the first place, stop people from getting infected, whether it's by applying barriers that would stop you, or improving your immune system so that your body learns what a coronavirus looks like, so that when you do get exposed to it, the immune system will immediately kick in and get rid of the infection before it establishes itself. So no, I can't see any light at the end of the tunnel when it comes to actual treatment. But for prevention, we are really starting to see light at the end of the tunnel. Israel only just recently announced that 1 million people have been vaccinated. In Israel, a lot of countries are making progress, and by the time we get the vaccine in the next 1 month or so in Nigeria, most likely tens, if not hundreds of millions of people across the world would have had this vaccine. And for those that are concerned about the safety, I hope they will be assured at that stage that the vaccines are really safe, and where it's in our overall best interest to take them.
Now, Dr. Sani, thank you very much. I just wanted to clarify regarding your take here now regarding claims by Nigerian scientists regarding the mutated variant discovered in the UK that has been existing in Nigeria for some time. I thought, you might be able to sort of put us in a better, shed more light on the situation. Is that the case? Has this mutated variant been in Nigeria all this while, as far as you know?
No, so as far as I know, no, that's not right. The information we have from Professor Chris Happy's group is that they did detect a mutant, but this mutant does not have the same similarities, the same characteristics as the UK strain. The UK strain had an additional 22 deletions, which was not present in the Nigeria strain. So no, it isn't exactly the same. And remember, since the coronavirus, the COVID pandemic started back in December in China, over 4,000 mutations have been described within the coronavirus itself. So mutations are fairly common with RNA viruses. At the moment, we don't have confirmation that we do have this strain, but it's one of the reasons why we have tightened up on control in terms of passengers coming from the UK and South Africa. They have to have a QR code or a permit to travel, which is downloaded from the website, and we are also keeping a separate list of those that have arrived from these countries. I think it's extremely important that we continue to protect and prevent new introductions of new strains of coronavirus into the country. But at the end of the day, what will really make a difference is people keeping to those non-pharmaceutical interventions, and also travelers that come in, making sure that they comply with our regimes, our protocols. When they come in, keep away for 7 days at least, and then have a test. If you do that, whatever you are carrying, you're not going to transmit it to the community. Because the coronavirus will not walk out of the room that you are isolating yourself in and infect somebody else. Provided people follow our protocols, we should be safe until such a time that we have the vaccines in place and the majority of our citizens are vaccinated.
Indeed, Dr. Aliyu. Now, I know you're a scientist and you have your reservations, but is there any partnership with traditional medical, practitioners rather, on research into the COVID issue? You never know, we might actually have the answers right within our shores.
Indeed. We very much support anybody who wants to come in and assist in this endeavor, but our only condition is that whatever you introduce, it has to be validated, it has to follow the same rigorous trials that any modern medicine follows. There will be no shortcuts, and there will be no introduction of things that are based on not on sound science. It has to be demonstrated to be safe and effective, and be able to show that it works just as well as other modern medicines do. So no, we have nothing against the traditional medicine, but they have to follow the same rigorous process as anybody else when it comes to clinical trials.
Yes, and I'd like to ask, what your assessment of, how Nigeria is coping with COVID-19 is.
I think it's disheartening that the numbers are continuing to go up simply because we have failed to change our behavior. We still continue to have huge mass gatherings of people congregating without any face masks, without any physical distancing. We're grateful to the state governments that have started enforcing this. We're also grateful to the religious leaders that have been sensible enough to put out the message to their congregations. But really, this needs to stop. Unless it stops, the numbers will continue to go up, and we'll start having huge issues with our health sector. So my appeal to Nigerians is to please observe the non-pharmaceutical interventions. Keep away from the crowds. If you do not need to go out, please don't. If you are elderly or you have comorbidities, now is the time to lock up, really, and to remain safe. And for those of us that have to go out and mingle with people, make sure that we wear our face masks, protect ourselves and protect our loved ones.
Indeed, Dr. Aliyu. Now, in view of the challenges you've just highlighted, what is the likelihood of more lockdowns at this rate?
Well, there isn't a lot of appetite for lockdowns, but all I can say is a government will not sit down and allow citizens to get infected and die from a preventable disease. If we don't want a lockdown, we have to comply with the non-pharmaceutical interventions. If you go to certain countries, Dubai, for instance, where a lot of Nigerians are currently holidaying, you cannot go out without a mask. But their shops are open. Everywhere is open. Their commercial activities are ongoing. But they are able to enforce this, and people are able to cooperate with them. And that's why they've been able to keep their infection at bay. If we can do the same, we've been 10 months into this pandemic. If we had followed all the rules that we needed to, this thing would have been over by May, June, July, max. But here we are in January, almost a year later, and we're still struggling with the same pandemic. And it's getting worse, not better. Now is the time for us to make sure that we follow these protocols. They may be inconvenient. We're all social animals. We like socializing, etc. But let's try and keep away from each other. Let's try and protect ourselves. If we do that, once the vaccine comes in, we will make sure that it's delivered within a very short period of time so that this can be over. If we don't, and the numbers continue to multiply, there's no way government will sit down and allow things to deteriorate. We'll have to take necessary steps to curb the increase.
Let me quickly go back to the vaccine once again, and sort of ask for specifics. Who are we talking to in terms of getting these vaccines here in Nigeria? Because you did mention earlier that they are likely to arrive by the end of the month. So which company in particular, and how many will be arriving in terms of the dosage?
So I'm afraid I can't give you that because it's not, it hasn't been announced yet. As I said, it's the National Primary Healthcare Agency that's working with Gavi. But as soon as we have confirmation, we will let the public know. There are a lot of conversations going on with Gavi. Gavi is linked to most of the vaccines that have currently been licensed. And as you know, WHO recently also gave initial authorization for one of the vaccines. Whatever vaccine is introduced, it's unlikely to be just one because we are not going to put all our eggs in one basket. It will probably be a mixture of maybe 2 or 3 vaccines. We're also aware of the limitations when it comes to logistics, etc. But across the board, whatever vaccine we introduce would have been scientifically validated. The safety would have been established, the efficacy would have been established, and it's very likely that millions of people across the world would have had that vaccine before it's introduced into Nigeria. So I really hope that will provide additional confidence to people that these vaccines are safe and can be used in humans. And they are important for our overall interest as a country.
Indeed, Dr. Aliyu, and we hear that NAFDAC is ruling out universal trials when the vaccines actually get into Nigeria. Can you authenticate that?
Well, NAFDAC has a very important role. It's a regulatory agency. No drug can be introduced into the country without the sign-off by NAFDAC. And I know they have already been linking up with some of the vaccine manufacturers out there. And by the time we have the vaccine coming in, NAFDAC by then would have given the sign-off. But I cannot comment as to whether a clinical trial would need to be done or not. To me, if you have the best clinical trial, really are the rigorous clinical trials that have happened, the phase 1, the phase 2, the phase 3 clinical trials, and also the massive number of people that would have received the vaccine by the time it comes to Nigeria. It would be silly for us to start a clinical trial right from the beginning. Some of these clinical trials have been done in Africans in the US and also Black Africans in other parts of the world. So provided the data, the documentation that NAFDAC has, they are happy with it and they've signed it off, I don't really see a problem.
And can I get some more information regarding the rollout of when the rollout plans when the vaccines actually arrive? How will the list be prioritized? Because I understand millions will be getting the vaccine. So how would that be prioritized?
Indeed. So our priorities will be healthcare workers, people, elderly people. I'm not sure we've established the exact age, but most likely those above the age of 60 initially, those with diabetes, cardiovascular disease. So those that are most likely to have severe illness. And then after that, we then move on to the next stage, younger groups, maybe those above the age of 50 plus, and then gradually roll it across the population. But our 2 main groups that we are most concerned with are healthcare workers and the elderly, and those that are at risk of severe illness. The initial vaccines, the numbers, the amount that we are going to get is not going to be enough to vaccinate everybody, and initially. And remember that you have to give 2 doses, either 3 or 4 weeks apart, in order to have a really good immune response to the vaccine. So in a way, this is going to take at least a month or 2 before we start having a good cohort of people that are immune to coronavirus. And that's why I keep on talking about making sure that we comply with the non-pharmaceutical interventions. We already have a vaccine in a way, and it's called non-pharmaceutical interventions. It's cheap, it's easily available, it's already available, and all we need to do is to make sure we comply until the modern vaccines come through.
Indeed, Dr. Aliyu. Now, let's talk about the sensitive nature and the handling of these vaccines. We've learned that some have to be dispensed at certain temperatures. Now, do we have the infrastructure to support that, especially with storage and, dispensing these vaccines?
Yes, so as I keep on saying, the Primary Healthcare Agency has a lot of experience with delivering childhood vaccines across the country. Yes, some of the vaccines have very cold temperatures. We call them ultra-cold chain. But there is technology available that allows these vaccines to be kept at very low temperatures, -70, until they are used. You can use them, you can store them at normal refrigeration temperature for some days, because obviously you cannot inject something that's at -70 into somebody's arm. So you still have to thaw the vaccines, and you have up to, I think, 4 or 5 days for some of the ultra cold chain vaccines that can be kept at between 2 to 8 degrees in a normal refrigerator. But there's a lot of work going on and a lot of analysis looking at the logistics, etc. I'm very confident with the simulation exercises that the primary healthcare agency will be doing over the coming weeks, that they will be ready. But as I said, we're not going to put all our eggs in one basket. We're not going to go for just one vaccine. We're going to go for most likely a range of vaccines that have already been validated and licensed. The logistics will be huge, there's no doubt about it. But to me, the biggest challenge really would be convincing people to take the vaccines. There's an academic institution in the US, just a few days ago, I was told 30% of their healthcare workers rejected the vaccine. So I think that's where we're going to really have to work hard in terms of risk communication and engaging with communities to convince them. But fortunately, we already have a lot of experience with this going through in terms of the polio vaccination. The main difference being that the advent of the social media, with every step we take forward, we're taking 2 steps backwards because of what's going on in terms of fake news, etc. That really has to be addressed first. But I wouldn't worry too much about the ultra cold chain. There are solutions to this, very good solutions available.
Okay. All right then, Dr. Sani, thank you very much for giving us the information that you've just... Can I just get you to hold? We need to take a quick break. When we return, hopefully we'll carry on this conversation. We have quite a number of questions to ask you. Thank you very much. We'll be right back. Stay with us.
Welcome back to Newsday, and of course we've been talking with Dr. Sani Aliyu, National Coordinator of the Presidential Task Force on COVID-19. He's still on hold to give us more insight on how the COVID pandemic is being handled in Nigeria. Dr. Aliyu, it's good to have you back. So earlier on we were talking about the vaccines and the nature of it. So are we going for the much touted Russian vaccine Sputnik 5, I believe? Its composition is still shrouded in secrecy. What do you make of that?
As I said earlier on, I cannot tell you precisely the specific vaccines we will go for, but all I can say is whatever vaccine we take, or the vaccines we take, must have been validated. They must have passed a rigorous process. The data must be very transparent. The clinical trials must be available and accessible to all, and they should have been used in tens of millions of people by the time we get them. And they must have been accepted by the international community. So we will not take a vaccine that may not have been validated or where the trials may not be entirely transparent. And I'm not trying to say that the Russian vaccine falls into this group. All I'm saying is at this point in time, I'm unable to provide you with the details of which vaccine, but very soon the Primary Healthcare Agency and the Federal Ministry of Health will make public the specific vaccines. But the vaccines will actually, the initial set of vaccines will actually come through Gavi. And you only need to look at what Gavi is currently making available or will be making available. That will give you a very good idea of what we are likely to get.
Now, a number of times you've actually said, for people to keep to non-pharmaceutical controls. If there's any one of our viewers watching and they're not quite sure what that is, can you sort of elaborate a little bit more on that?
Of course. So when we talk about non-pharmaceutical interventions, what we are trying to do is to prevent the virus from infecting us. So any sort of barrier you put across your face, i.e. using a face mask, will stop you from catching COVID. Any space or distance you put between you and an infected individual, because it's a droplet infection. When you cough, the viral particles are within large drops, and these large drops do not remain suspended in air. They settle on surfaces. So you keep a distance from whoever you are meeting. Because they settle on surfaces, if you touch a surface that's contaminated, you can easily touch your face and end up having the infection. So you wash your hands regularly, you use a sanitizer, and you avoid touching your hands. You avoid crowds, and you also avoid enclosed spaces. Because if you are in an enclosed space with somebody who is infectious, you are 19 times more likely to catch it than if you are outside. Because if you are outside, because of the wind, etc., the viral particles, even if somebody coughs, will not reach you, even if you are fairly close to the person. So those are the key things. But the most effective way of preventing infection is to assume that anybody you meet is potentially infected with coronavirus, and you treat them in that way. So if you meet somebody with coronavirus, you're not going to shake their hands, are you? You're not going to kiss them. You're not going to allow them to come too close to you. You'll make sure that your face mask is properly covering your face. If they are not wearing a face mask, you will ask them to put up their face mask as well. And you certainly wouldn't want to stay with them in an enclosed space for a prolonged period of time. So these are the sort of non-pharmaceutical interventions. They're actually based on common sense. Because respiratory viral infections have been with us for quite a while. Pandemics have occurred on and off, and over time, humans have been known to adjust to this. And if you are infected, if you have symptoms of a cough, a cold, a fever, do not mix with people. If you have a child who's having a cough or runny nose, do not send him to school. So these are the sort of non-pharmaceutical interventions. It's really common sense when you think of it. But maybe because we are saying that people should not interact with each other and we are social animals, it's becoming incredibly difficult to implement this. People don't like wearing face masks, but you have to wear a face mask if you are in public. And we will make sure that this is enforced working with the state governors. As we move into January, we're going to be a lot more strict when it comes to these measures. For people that are in government offices, not wearing a face mask will be unacceptable. For commercial premises, if commercial premises are allowing people to go in without a face mask, we will close them. For the hotels, we've already advised state governments to close hotels, bars, nightclubs, etc. We've reduced the number of people in congregations. We've advised the religious authorities as well to make sure that they reduce the number of people by 50% so that you can have distance between each other. But moving into January, because of what's happened in December, the likelihood is the numbers will go up significantly. And if they go up significantly, it's not going to help our economy because we may be forced to take measures that are not very palatable, which we definitely don't want to. So again, I'll keep on appealing to the general public. Please wear your face mask when you go out in public. Please keep away if you have respiratory symptoms. Please make sure that you have a test if you think you might have COVID. Some of the symptoms may be very subtle, such as a loss of smell or a loss of taste suddenly. The majority of people, 80% of people, will have mild illness or none at all because they are mostly young people. But for the elderly, it can be devastating if they catch this infection. If you're above the age of 60, we've been able to show with our data, even younger people, between the ages of 50 to 59, 23% of them died when they caught COVID, the ones that we have on our data. That's huge. That's almost a 1 in 4 chance of death. And it's almost like playing Russian roulette. So particularly if you are in an older cohort or you have comorbidities, stay at home and don't allow people to come in to infect you. This pandemic will be over sooner rather than later, hopefully, fingers crossed. But at the moment, it's still very much with us, and we need to protect ourselves and protect our loved ones.
Indeed, Dr. Aliyu. Now, in 1 minute, please, finally, still talking about data you mentioned, there are thoughts that the current COVID-19 infections figures might be higher than what is being actually indicated and put out there. I'd like your clarification on this, briefly.
Yes, so for every 1 case we diagnose, we're possibly missing between 7 to 10 cases because not everybody is coming out to test. If we were testing widely, just like in other countries such as South Africa, for instance, and people are engaged with us and really coming out if they have symptoms, etc., I am very sure that our numbers will most likely be approaching 1 million because at the moment we have about 80-something thousand. As I said, we are missing between 7 to 10 cases for every positive that we get. So, and I'm sure for a lot of us, I've already received loads of calls. I know a lot of people that have had COVID, and I know people that have had symptoms of COVID that will tell me, oh, I had a cold a few weeks ago and I actually lost my sense of smell. So far, all the people that we've tested with a loss of sense of smell have turned out to be COVID. Yes, other viral infections can give you that, but at the moment, If you have those symptoms, the likelihood is it's COVID, and please keep away from people. Go and get yourself tested, and do not mix and do not transmit this infection to the rest of the community.
Indeed. Dr. Sani Aliyu, National Coordinator of the Presidential Task Force on COVID-19 in Nigeria, I'd like to thank you for your insight on those issues. It's good to have you.